Hello, I am Dr. Jagdish Hiremat. I am a cardiologist practicing in Pune for more than 3 decades. Blood pressure or hypertension has been one of the major diseases that we treat in our day-to-day practice, and whether all specialties of medicine need to know something about blood pressure. The Achilles heel or the most important aspect of blood pressure is the measurement. Nowadays, there are no mercury manometers, and we are encouraging home blood pressure monitoring. Every household, I feel, should have a thermometer gun, a pulse oximeter, a glucometer, a weighing machine, and a blood pressure apparatus. So each one of us have to make an effort to educate people to do a good home blood pressure monitoring. And for that, we have to be ourselves very clear about the method of blood pressure measurement. And internationally, it should be measured by just one standard. And that's why this endeavor of coming to you and talking to you. Because blood pressure measurement, unless it is done well, everything can go wrong. Our treatment methods, or the effect of the treatment, everything can go wrong. Okay, here is dates. Any equipment, usually it is an electronic one. They are accurate, but very sensitive to the method by which record the blood pressure. So sit in front of a table on a chair. Both your legs should be on the ground and not crossed. If you cross the legs, the blood pressure can go up by almost 2 to 8 millimeters of mercury. Your back should be resting on the chair back. The arm, the tabletop, and the heart, they have to be on the same level. So something like this, the posture should be. There should be no cloth on the arm, because if there is a cloth, the blood pressure difference can go up to almost 50 millimeters of mercury. That important is the bare arm for measurement of blood pressure. Once you tie the cuff in this way, 2 feet on the ground, back is rested, arm is bare, and the 3 aspects, that the tabletop, the arm, and the heart, are at the same level. I would request you, all of you, to teach your patients to wait for a minute, doing nothing. They should not talk to anyone, because talking can increase the mercury systolic pressure by 10. They should not be doing any other activity, because that also will increase the blood pressure measurement. Once they sit quietly for a minute, switch the machine on, and then the blood pressure method or the measurement that you get is the real blood pressure. So you have to then note down your systolic, diastolic, and the pulse that comes along with it. Now, when this is done, the patient should be in a quiet state of life. That means there should not be a tea or a smoke or heavy physical activity or a meal half an hour around that blood pressure measurement. So a quiet time of the day and this kind of a blood pressure measurement will then give you the correct blood pressure measurement. And once you do that, I think that is the start or the beginning of good management of blood pressure. Even if this correct measurement method reaches every household, the job is well done.